觉得 Annabelle 不会口渴。电话呢？这边我的电话在这边。没有手啊，这边。
Okay, let's start for our lecture today. Good morning, everyone. Good morning. So our topics today is about ethics in research. Okay, so this topic will be divided into two parts, which is part 1, and we will have continue. Okay, the part 2 of this topic in our coming lesson. So in our previous lecture, we already gone through all the principle of ethics, and we also gone through the professional healthcare and patient's relationship. Okay, so today we will talk about more focus into all the ethics involved in the research. So the learning outcome of today, you need to understand the difference. So we will go through the two difference between the observational and experimental research. So what are their different? And you have to understand the ethical requirements between the animal and the ethics research, okay, in healthcare. So at the beginning of this lesson, we will cover all the ethical guidelines involved in human. But at the later part of today's lecture, we will cover some animal research, okay, together in this topic. So I have actually uploaded a PDF file of this international ethical guideline, so in the e-learn. So this is a very complete, okay, very comprehensive, complete guideline. So involve a lot of topics. So we will only cover those who are important, we want to focus in this lecture. So if you require more information or more understanding, related to all the ethics involving human, so you can refer, okay, to the guideline in details after the lesson. Okay, so the topic we will cover is the guideline 1 to 6, guideline 9 to 16, and guideline 17. So our topics today is the ethics in research, right? So at the very beginning point, so what is the meaning for research? What is the meaning or definitions for research? So research is a systematic investigation involve design of experiment, right? You design an experiment and then you perform some evaluation or some analysis, okay, to perform or to create some generalizable knowledge. You want to know something from your research. You want to get some answer or get some knowledge, useful knowledge from the research. So research study is divided into mainly two different types. We have observational study and another type is the experimental study. So for the observational study is the study that only observe the outcome. You observe what is the difference between your experimental group, okay, without any intervention involved. So the interventions here meaning manipulation, without touching or without any try to influence the subject, which is human, okay, in this case. So, and usually you just observe or examine the relationship. So the example of observational study, usually we have cohort study, okay, or case control study. So what is the difference between any difference between the cohort study and the case control study? So the cohort study, usually you recruit your participants, okay, you recruit the human based on some similarity. For example, all of you are cohorts in taking the subject of BIO 1272, right? You all are a cohort, a same cohort. Or I can recruit the cohorts based on your date of birth or month of birth, right? So I want a cohort of who are having the month of birth on starting from January to June, or at the end of the year. So I can specify the groups, the cohorts based on some similarity. Okay, so example of the cohort study is like, for example, I want to study, okay, the lung cancer, the effect of smoking on a lung cancer, on all the lung cancer patients. So I have to recruit all the patients with lung cancer, right? So and then I divide them into different cohort like smoking and non-smoking, and relates them to the mortality rate, okay, the death. How many involved in smoking contributes to high percentage of mortality. Okay, this one is example of the cohort. Case control study. Case control study is where you involve one group without any disease or any health problem. So for example, if you want to observe, study, examine the symptom of COVID infected patients or non-COVID infected patients. So you need a control, okay? The case is meaning those having health problem, meaning all the patient or individual infected by COVID, right? But you need another group as the control where they do not infected, no any COVID infections history before. Okay, in this study, that's why it's termed as the case and control. You have the case and you have one group serve as the control. Okay, so next one we have experimental study. So experiment study is all kinds of experiment involve any manipulation, okay, or intervention that will introduce an interventions and measure its effects to the participants or human. So intervention can include any surgery, okay, or therapy, drugs. Okay, you want to give certain types of drugs, certain types of vaccine, or you want to do some lifestyle changes, okay, to your participants, or even some education, okay, educations and exposure, okay, to certain groups of population or participants. And usually in experimental study, the participants are recruited as randomly. You just set a guideline. Okay, I want to recruit all participants from age maybe 18 to 65. So you will recruit all the participants randomly, and then you assign them into different different group. Okay, one group will receive some treatments, and another group will didn't receive any treatment. Okay, so this one is example, and you need to assign them randomly, meaning the subjects are grouped by chance. Okay, you recruit them based on your inclusion and exclusion criteria. For those, maybe you want to exclude something lah, maybe those who are weak or those who are vulnerable. Okay, we will look into more detail later. So the example of experimental study always involve some clinical trial. Okay, in clinical trial where you need to recruit the participants in random form and then assign them into 2 groups or 3 groups in equal 1-to-1 ratio. Okay, and then you give them treatment. Okay, for example, I want to study some effects of probiotics to COVID patient. So I recruit, okay, all the COVID patient and then non-COVID patient, and then we have some treatment. I give some treatment, okay, for them to consume for intake. So this one where you involve you give something to the participants and study their effects is known as the experimental study. So the reason why we want to gone through study all these guidelines involved in humans subject is you need to justify, right? Before you want to start your study, okay, before you want to initiate any study, you need to get the ethical approval. Then you need to justify why you want to use human subject, right? They will first ask you why. Why do you want to use human? Why your study involve human participants? So in order to get your ethics approval, so you need to make sure you fulfill all these guidelines, which is actually covered by the FAO, okay, the guideline, international guideline of ethical research involving humans, human sample. So the first important, okay, the first important point you need to justify your ethics application, okay, to justify why you want to use human in your research study is the scientific and the social value. Okay, now what is the meaning of scientific and social value? Okay, we will start with the social value first. So social value normally indicates how importance of your research study. Okay, in the terms of what are the important information you can generate from your research study, and how we can know that it is either if it is an important study or not. We can base on the information whether your study can promote understanding. Okay, your study can generate some knowledge to promote understanding of the society. Okay, or your study actually have a very high social impact because it intervening on a clinical significant health problem. Is actually okay, has some impact on a significant health problem encountered by the society currently. Okay, then this will your research, your study is meaning that has a very high social value, and your study also can affect some clinicians' decisions will based on the research study, right, to perform their manipulation. So if your research is very good, so they may apply, okay, your interventions to their patient. So if your research is able to influence their clinicians or doctor or some policy maker decision, health and social policy maker, or can influence some resource allocation. Okay, so meaning that you have a very important social value in your study. Okay, so the last one is the disseminations of research. So meaning that how well you disseminate your knowledge. So if you are just performing research alone and without sharing the data, so no one will know, right, your research about your research. So in that case, your social value will be very low in terms of your study, because the aim of your research study is you want to create knowledge, right? You want to create knowledge to the society. That's why if you have performed some research study, normally we will do some publication to share. Okay, even though your result is negative or you fail in the experiment, so we share the knowledge so that people's society will know what is happening. Okay, and this also can contribute to the high social value. Okay, so next one is the scientific value. So scientific value meaning your research study have to sound scientifically. Okay, you have a good sound of methodology which can bring confidence to the participant, and also to provide reliable or valid. You need a good method, right? You can, if you simply do some experiment, will the data obtained reliable? No, right? So of course you need an established research methodology, sound scientifically, and provide reliable or valid information to obtain to achieve your objective. So base depends only on the social and scientific value is not important. Okay, it's not sufficient to justify your ethical approval. So we need to also emphasize the respect for the right and the welfare. Okay, this we already touched a bit in our previous lesson. And how we going to express our express. And we take care of the participants' right and welfare. How are we going to show this? In the consent form, right? Yeah, in the consent form, we can show all our respect. That's why you need to follow all the requirements of your consent form. Please emphasize on all the sensitivity case to the justice issue. Okay? Please make sure that if you are recruiting all the vulnerable participants, make sure that you concern about their needs, medical needs. Maybe they need extra, okay, extra concern. And random, okay, recruit inclusions and exclusions of participants. Make sure you are performed without any bias, without any prejudice. Okay? Then make sure you do some benefit and risk assessment. Okay, you have to address what are the risks and what are the benefit, okay, in your consent form. And make sure you included all the information on who will access of all the resulting knowledge and information. So all this information, remember, we have gone through all the right, all the humans' right. Okay, they have the right to ask, they have the right to question, they have the right to withdraw anytime. So all of these informations need to be included in the consent form to show our respect and their right. Okay, so based on only the scientific and social value, we cannot actually protect, we cannot legitimately subjecting the participants to any mistreat or injustice. Okay, although the scientific and the social value is very important. That's why we need to include the third principle, the respect for the right and the welfare in the consent form. Okay, so the next principle is to make sure that you have addressed, okay, all the equitable distributions of benefit and burden, okay, in the selections of individual and groups of participants in your research. So what is the meaning of equitable distribution? So in terms of participant selection, so as I mentioned earlier, so you try to select participants based on scientific reason. Don't simply recruit your participants based on your own preference or based on your bias. Okay? Or you know some groups having some, you can influence them, or there are certain groups of the participants have some social or economic position. So you want to recruit them due to their position. Okay, no, this one is not permitted. And then due to some ease of manipulation, so you can influence the participants easily. That's why you recruit them in your study. Okay, for example, I invited all of you to join my research, and I can assure you all with a grade A in your ethics subject. Okay, this is one example where it is unethical. Okay, because I have already given some influence to you all. Okay, in terms of the easy of manipulation. And exclusions of the group, next one, we have the exclusions of group in need of special protection may be justified. So usually we recruit participants randomly, right? So we will include adults, and then the order to include is adult, and then we will do some elderly, recruitments of some elderly, okay, older generations, and then we will do recruit some children and pregnant women as well. Okay, so if you want to exclude certain groups, okay, for example, I want to exclude children in my research study, so please make sure you provide a justification and you provide why. What is the reason? Okay, for example, you're conducting a toxicity study, so you are reasonable, right, if you want to exclude elderly and you want to exclude children, because you don't want to let them exposed to the risk of the toxicity. Okay, so in a normal order of the clinical trial, normally if you are aware of our previous recent clinical study about our vaccine, okay, COVID-19 vaccine in the clinical trial, okay, usually they will recruit adult first, right, in the clinical study. After they have successful in the adults, so they will recruit elderly, okay, followed by children or pregnant women. Okay, so this one is the normal order. And next one, unbenefit group should not bear any risk or burden in the research participants. So as I mentioned, if the children is not really can be benefit from the research, okay, so if you are investing some let's say you are want to study some vaccine only effective in children, so do you necessarily include the human adults in your study, because that vaccine may have no direct benefit to them. Okay, so you have to consider properly when you perform some participants recruitment. And then provide access for the underrepresented groups to the health research. So the meaning of this one is try your best to recruit, okay, as random as possible. So the underrepresented group to the healthcare research, usually we stand for foreigner. Okay, yes.
他们来你先年的是能力。
Because already in standby mode connecting. Okay, I think should be okay now, right? Okay. So, the populations belongs to the underrepresented group, meaning those populations like foreigner or those cannot communicate with your language, right? Or different color of skin, or refugee, okay, or any population, or homeless individual, homeless participants, where they only occupy a minor population and not well represented in the healthcare research. So try not to exclude them, okay? Try not to exclude them, and because this will create some difference, okay, disparity, okay, in your result. Try to include them randomly, even though you know that some of them has some communications barrier. They cannot understand you, okay? They cannot speak your language, or try to, okay, include as wide as possible. Okay, next one, we have the potential individual benefits and risks of the research. So we have to do some assessment of benefit and risk, okay, in the informed consents, okay, before your recruitment. So minimal risk is not saying that we do not allow any risk, okay. Minimal risk is acceptable provided it is outweighed by the potentials of the individual benefit, okay. So we can accept minimal risk, but not more risk compared to the benefit. Okay, so you need to make sure you address, okay, your risk and benefit in your consent form. And in a very high risk situation, placebo is not allowed. Okay, the placebos meaning here is like a groups of participants without giving any treatments or any drug. Okay, negative control. Okay, in clinical always you can see the term placebo. Okay, meaning that it's some negative control group. Okay, so this placebo group is not allowed if your study involve high risk, okay, matter, such as if you want to study some Ebola disease, which can cause high mortality rate. Okay, so it is very cruel that you recruit some participants and infect them with this dangerous virus, right? So in that case, placebo is not allowed. Okay, or it may induce some harm that is irreversible, okay, or permanent harm. Okay, if you know that your study will have high risk and it may induce some permanent harm, so your study will not include any placebo. So the minimal risk standard, you need to refer that your study need to have not more than harm that ordinary happening in your daily life or during the routine examination. So what is the meaning in this statement? So you need to make sure that all your procedure can have some risk. Okay, even you do withdraw some blood, it may have some risk, right? So the minimal risk is acceptable because blood withdrawal is considered as one of the routine examination, right? It's usual for you to withdraw blood in the hospital. But however, if you request your participants to withdraw some sample from the spinal cord, where you involve some anesthesia or you involve some special intervention, so this one is already create like higher risk. Okay, so you need to make sure that you have to reduce the risk to the minimum. Cannot request your participants to perform some high risk procedure compared to the normal routine daily life and the routine examination. So you must minimize the risk if no potential individual benefit. So maybe some of your study do not have direct benefit to the participants. Okay, you are recruiting, doing the research for the whole social population, okay, in the future. For example, if you want to develop a vaccine, right? So you are not sure whether it will create any benefit to the participants, right? But it will create a great impact in the future for the society. So in this case, try to reduce your risk to the minimum because they don't get any benefit. They join your research based on their own voluntary, right? So try to reduce all the risk and generating, of course you need to generate the knowledge of social and scientific value, as I mentioned, but in terms of how you can minimize the risk in terms of generating high social and scientific value. So in your research you have to sound scientifically with a proper method, right? With a proper method, so that if you have a better method, if you have a confident scientific method, so indirectly you can minimize the risk, right? Not simply use some not mature procedure or not mature intervention. Okay, this will give also some confidence, some support to reduce the risk of the participants. So next one, so in the experimental study, okay, in clinical trial, let's say, so always we will need some control, okay? The negative control placebo is not allowed if you perform some high risk experiment, okay? But in some low risk experiment or low risk study, you need the control, right? Of course, you need a control without a drug, without a treatment, compared to a group of participants given with a drug, right? You need a control. So in what situations we can use a control? We already say that if your study will create some significant harm, so placebo is not allowed, or life-threatening, okay, life-threatening high-risk disease, placebo is not allowed. So for other study, involve diagnostic or therapeutic or preventive intervention, usually they will need a groups of the control, so that you can compare, right, without having the treatment, and then compare to those groups having the treatment. So placebo may use, okay, you can use placebo control in your study if your study have no established effective intervention. Okay, you want to study some effective, like COVID, we don't have any drug for COVID, right, until now. Okay, so you can, and COVID will not create very high risk of mortality. Okay, so you can include placebo if you want to perform some study. So because there has no established, not you don't want to give, there is no effective interventions for this study, right? Not you don't want to give. For the tuberculosis, syphilis, they are wrong because they have the drug but they don't give, right? This one you can include the negative control group, but not saying that you don't want to give them intervention, but there has no established intervention. Or if you have established intervention, so you need to make sure all your negative control will receive, okay, will receive that established intervention that can actually decrease their suffering, decrease their mortality, and decrease their morbidity. Okay, this is the requirement where you can use placebo in your study. Okay. Okay, so you can, if you have all the clinical trial, okay, include the placebo, you have to make sure that you have the established, okay, you have the intervention, or there are no current intervention, right? Okay, not you don't want to give the medicine, we have no any option to give. But if you have some drug, but if you have some intervention, you can choose not to, you can include your placebo, but not giving the intervention if you have questionable efficiency of the established intervention. Okay, you have some drug, but you are not sure, not really sure of their efficacy. Sometimes the interventions might work, or sometimes it might not work. Okay, in this case, you need to give, but you can avoid, okay, of giving the established intervention. Or the risk of the adverse effect from the established intervention is greater than benefit. Okay, there is some established intervention, but it will increase the risk. So why not you want to give? Okay, can you all get me? So you need to actually consider whether you should provide that established intervention or establish the drug. Okay, and the clinical response for that specific established effective interventions is highly variable. It is not stable, meaning the drug is really not stable in this situation. That's why it is uncontroversial. Okay, you have the right to not giving the established treatment because you are not sure, the efficacy is unsure, or the established intervention may create more severe adverse effect to the participants. Or you can justify placebo has beneficial effect. Okay, meaning that what is the meaning of placebo has beneficial effect? Meaning, or if you don't give, or you hold, okay, withhold the established effective interventions will result minor risk. Okay, will result more than a minor risk above the minimal risk to the participants. So the risk here is such as the temporary discomfort or delay in relief of symptoms, just some minor. Okay, without distributing or delay in giving the established intervention, it will create just minor. Okay, very minor risk, just discomfort. You just will feel some discomfort. Okay, or some delay in relief of symptom. Okay, so this is some exceptional situations where you can use the placebo with some established interventions, but sometimes you may not give, okay, the established interventions to your participants. Okay, next one, you need to make sure that you provide, okay, address all the caring for your participants in your consent form of what their need. Okay, you need to make sure that you have addressed all the sufficient care, okay, in your consent form. Doesn't matter for which group of the participants. Okay, make sure that they can obtain continual care after the research, and for those, okay, have experienced maybe some serious adverse effects, okay, unexpected syndrome or unexpected side effect, so you need to provide ancillary care. Okay, ancillary care meaning some additional care, additional special care, because they have some symptom. Who knows, they might have some symptom like more serious compared to other participants. And then the last one, you need to make sure they have the continual access for the intervention, okay, which demonstrates some benefit in the study. Okay, for example, in this statement, For example, you have already discovered a drug which can provide some benefit effects to the participants. So can you stop the use of the drug from the participants after the research? They're having some improvement during the whole research study. But after your research ending, you stop. Okay, you stop providing. You stop the access of the intervention or the drug for the participants. So this one is unethical. You need to make sure you have addressed to them, address in the ethics that they will have continual access, still provide the care or still provide some therapy. Okay, and this one ancillary care also involves some rehabilitation care. Okay, where help them to restore, improve their health. Okay, some service. Okay, some healthcare service, healthcare counseling, or some advice to help them improve if they have, to help them recover, okay, from the side effect. Next one, we will have the individual capable of giving informed consents, which we also already touched a bit in our previous lesson, right? So is the researcher or doctor responsibility to seek for the patient's consent. You need to get the consents from the patient, okay, from the participants, and please do not initiate any research study without an obtain consent. Okay, so this one is very important. So is the medical professional responsibility. So they will seek for your consent, but after providing you all the relevant information or all the relevant knowledge about their research study. Okay, and then you have to make sure they are able to communicate. So meaning as certain your participants have adequate understanding about your research study and able to communicate with you, and try to restrain. Okay, please do not do some withhold information. Okay, do some unjustified deception or lie or hide some information or withhold some relevant informations or do some threatening or not good attitude. Okay, try to influence the participants. Okay, in order for you have very desperate to get the consent, but try to not doing all the hiding or provide them telling the truth. Okay, telling the truth. And later we will see there is some situations that we can withhold some informations in your consent form. Okay, we will see later. But at this moment, we are not allowed. Okay, this one is the normal procedure of obtaining in preparing a consent form and obtaining consent. You have to tell the truth and everything. Yes. Okay. So please make sure you give sufficient opportunity and time for them to consider, okay, for their decision, and then try to obtain. So it's a normal procedure for you to obtain a signed form, not through a verbal agreement. If you say, I want to record, okay, I want to record your agreement, okay, so you need to get them signed on the consent form unless you can justify, okay, the exceptions from the IRB. So you want to accept any signed documents of the consent form, later we will see, okay, what are the conditions you can exclude, you can waive. You can waive the consent form, and any modifications or any waiver of the consent form, you need to get the approval from the committee. Okay, what is the committee? Yeah, IRB. Okay, institutional review board. Okay, then last one, if you have some update informations about your consent form and you have some renewed information, okay, and your informations may influence the judgment of your participants. So in this situation, so you need to renew your consent, and which becomes as the reconsent is required. So you need to approach your participants again and explain to them all the additional information. Okay, and get their consents again. Okay, renew the consents form and make sure they provide you the reconsents document. So next one, so this is what I say if you want to modify, okay? If you want to modify or you want to waive your consent form. So there are some case where you can waive or you can modify your consent form, but you need to justify why you need to do so. Why you don't want to do according to the normal procedure and regulation. Okay, you need to provide a strong justifications to the ethics committee, okay, and obtain their approval before you do so. Okay, you cannot make your justifications yourself and proceed to waive the consent form. Any modifications or waiver of the informed consents will have to obtain the pre-approval from the committee member, okay, from the ethics committee. So if you the justifications for not following the standard, okay, the normal procedure for doing the consent form is your research study is impossible, okay, it's not feasible or practicable to carry out without the waiver or the modification. So meaning that you are unable, all your participants are refused to give your consent. You are unable to start your study, and your study has a great impact social. So I determined to continue. Okay, even though all of them, I know already, none of them will give me consent, and it involves some sensitive issue. So I need to proceed. So you need to apply, and the approval is subjected to the committee member whether they can give you approval. Okay, and possess, and your research study must possess no more than minimal risk. So if you want to waive, so you have to claim in your consent form to the community, to the committee, that you have no risk, or the risk is already reduced to the minimum to the participants. Okay, then only they will consider whether they can allow you to modify or waive your consent form. Okay, based on these three factors. So next one, you can modify. Okay, just now we say that you have to tell everything, tell the truth in your consent form. You have to include all the benefit, all the adverse reaction in your consent form. But actually, you can actually withhold some information in your consent form. But similar, you have to get approval from the committee first. You have to justify why you want to withhold some information, why you want to hide some information from your participants. Okay, so in order to maintain the scientific validity of your research. So some example, okay, we are giving some example. So for example, if your research is will require some monitoring, you need to monitor your participants with some compliance with a treatment. Okay, whether they are actually okay with the treatments or actually they are stick to the rules. So you actually can hide some information, not to telling them all the information. Because in this situation, if you tell the participants that, oh, I will monitor all your activities, all your daily lifestyle, all your daily habits, all your diet, I will monitor everything. So the participants, of course, will modify their behavior, right? So they will show good, they will act good, and which will lead to some invalid results. Okay, they already will have some impact on your results. So in these situations, you can actually not telling them everything. Okay, that I will monitor you. I will put a recording in your ward, okay, or in an isolated place to monitor all your activities. Okay, but you can withhold some information provided at the end of the study. So you need to give them, okay, what you are omitted, all the omitted information you have to tell them. And after they already know, the fact what are the omitted informations, always they have the right to refuse or withdraw from your study, or they has the right to not allow you to use their data. Okay, so this one have to clearly state, you have to justify. But as I mentioned, you need to get approval, not simply modify and withhold any information. Okay. okay, in your consents. And even compared to the withhold some information, actually you can also actively deceiving the participants, okay, by telling a lie or actually telling some inaccurate information. Okay, how this is going to be approved? Okay, so only in very limited or any special case. Okay, mostly IRB will not, okay, give approval in this kind of application. Okay, unless you really have a very good justification, such as you want to employ a pseudo patient. Okay, you want patients that actually mimic them as a patients and to study the behavior of the healthcare professional. Okay, and in their natural setting. Okay, so you can actually ask them to sign a consent form where they agree that they receive insufficient, incomplete information. They already know that the informations provided to them are not accurate, okay, are not true. Okay, they need to sign the consent form, okay, that they are receiving incomplete informations during the informed consent process. And after, okay, similar after your research study, you need to debriefing. Okay, debriefing meaning you need to tell them the truth. Okay, tell them what is the actual information, and we actually tell you a lie because of this situation, and these informations are not correct. So you provide them the correct information. So similar, you will offer the choice, the right for the participants to withdraw. Okay, after they listen to you for your justifications or new information, they has the right to disallow the researcher to use their data or withdraw, okay, from the following study. Next one, we will talk, just now the one is the modification. Yes? That's why this is the reason I do not encourage the online, okay, the online lesson. Because the line will keep disconnect. I think this student has emailed me to ask for the permissions to attend online, but I'm not really looked into the reason. Okay, so try to attend the class physically, unless you have a very strong justification, okay, to perform the. Of course, if you have the choice to attend online, so all of us we like to do it online, right? Okay, I would prefer to give my lesson, okay, through online as well, okay, instead of physical. Okay, so we already include all the with modifications of the informed consents. Now we will talk about the waiving. Okay, the waive of the informed consents for identifiable data or biological sample. So sometimes you have some biological sample or some identifiable data of health record, okay, in the computer. Okay, so you in terms of if you have these identifiable data and biological specimen, so you can waive the consent form because you already store, right? You already have this data and you already have this sample. Okay, so you want to do some experiment using this data or want to do some report using this data and this biological sample. So you can waive the informed consents provided it is not feasible or practicable, similar, okay, to the earlier. It is impossible for you to start your study without the waiver. Okay, you experience some difficulties in obtaining the consent. The best way is you try to, because it's identifiable data, right? So and biological sample, right? The best way is obtain the consent. Okay, but in the case if you want to waive, so you have to justify. Okay, justify and apply for the approval to show that it is not possible. Okay, if you are not waiving the consent, you cannot start the experiment. And your research has important social value, poses not minimal risk to the participants, and in the case of identifiable, Okay, the risk to those individuals are not greater than minimum. Okay, for the unidentifiable sample, okay, you can actually not saying like quite easier to apply waiver because the sample are unidentifiable, right? So you can apply the waiver provided you have a good justification and it create no risk. You just use the sample, no risk to the participants. Okay, you just use their record. Okay, which is unidentifiable. Next one, we have the special considerations for waiving informed consents in study using the data in health registry. For example, you need some data from some big community, or for example, cancer registry, okay, or some genetic, okay, data banks of genetic, okay, or you want to study all the abnormalities of the newborn baby. Okay, for this you need to obtain, okay, you need to obtain the data from some registry, right? So you can actually has a special considerations to waive the consent. Okay, provided the importance of having comprehensive and accurate information about the entire population. So you need all the informations about the whole population. Okay, and then the scientists need to include all cases in order to avoid undetectable selections of the bias. You need the data from the whole population to avoid any selections bias. Okay, so in this case you can apply some special considerations for waiving the informed consents, and the ethical principles between the burden, okay, risk and the benefit is equally distributed. So in these three considerations, committee may consider, okay, to waive your consent if you need to use all the data, okay, from the health registry. So don't forget, last time in our previous lesson we already say that in certain case we do not need the consent, right? It is still considered as ethical, okay, if we do not obtain the consent. So meaning if you need some information from the health authorities subjected by the law, okay, or ordered by, you need to perform this study ordered by the court, or it is some instruction is mandatory by the law, so you can actually waive, okay, directly straight away, no need to apply, you can straight away waive because it's an instruction to you. Okay, and what else? Okay, so disconnect again. Do you all want a break before we continue? Okay, 5 to 8 minutes break from now.
露出来了。我呢到你们。
Anyone who are late want to do the check-in? I do for you. Sorry, essay writing. Okay. Oh, that one doesn't matter, right? Usually I do not give up mask based on age, like format lah. Don't worry.
Yeah. ใช่很好。准备，因为这个用处。LASIK surgery. Breast milk. Chicken 讲啊。你叫我 breast milk。
let's continue. Okay, so just now we already talked about the waiver of the consent form. Now in the aspect of collection and storage. Okay, so if you obtain some sample or some biological samples and related data, so in the consent form you need to tell them, right, how you're going to keep all those data in private, okay, and encrypted all the related data. Okay, so for the biological material as well, you can keep those samples in some liquid nitrogen, okay, or some deep freezer for further analysis. But in terms you want to use these related data or biological materials collected, okay, collected in the past or store, okay, store in the facility. So you need to actually, okay, has the authorization, your institution, okay, or your hospital, you need to govern has a governance system to obtain authorizations for future use of these materials in research. Okay, so you need to make sure in your consent form you have to specify, okay, the use of this type of sample or data in future, okay, in your future study, not only in this your current study. Okay, you need to make sure that you have included this one. And when your specimen, usually we will add into our specific informed consent form for particular use. So up to now we still prefer, okay, the specific informed consent form for every specific use, okay, but you can actually do a broad informed consent form. Okay, what is the meaning of the broad informed consent? Where you include, okay, for unspecified, you include all the unspecified future use, okay, from the person, and then the person will give you acknowledgement or consent the participants will give you consent to use their sample in the future, okay, under some range of the study, okay, a range of some research. So for the broad informed consent form, is not saying that it's a very no any regulation, is very broad, okay, or unlimited use. Okay, so you need to specify also what are the range of the future use, okay, and also the duration of the storage. How long probably you want to store the sample, and then how long, okay, give a specific duration, and then include also what is the rules of access, who can access all these biological sample, okay, and the donor, okay, the donor or the participants can actually contact a representative, okay, of the biobank to remain informed about the future use. If they want any follow-up, okay, if after 5 years later, so the participants has suddenly recall that they have some sample, okay, in your storage, so they has the right, okay, to get the information, and they know who to contact, okay, the representative or custodian, to remain informed about the status of future use. So if you have listed a few several foreseeable future use in the broad consent form, so and accidentally your future work the future work you plan to do is fall outside the range of the future use, okay, what have stated in the broad consent form, then in this case you have to ask for reconsent, okay, if the scope you want to use, okay, the participant always has the right to know what you are going to do on their sample, okay, and you have to ask for reconsent if you're doing something which is not included in the broad consent form, and remove some personal, and they can request you to remove their personal data or materials from biobank anytime, okay, they can request you to destroy their sample, or they can request you to return their sample, okay, and not allow you to use their information. So if in terms of the residue tissue, okay, leftover biological specimen, okay, usually for researcher we are interested to all the leftover tissue. because we have like less tedious, because if you want to request new sample tissue, we will need to get the approval, go through all the procedure again, right? And then waiting for the participants' recruitment. So usually we are very interested on all the leftover biological specimen, and if you have leftover biological specimen in your environment, so you can actually have two choices. One is get the informed consent. Okay, try to ask permission again from the donor to use their sample. Okay, very easy. Okay, and then next one is informed opt-out procedure. So what is the meaning is the informed opt-out procedure? Informed opt-out procedure is you contact the participants and ask them to sign opt-out procedure, meaning that if you don't tell me, you disagree, I assume you consent. Okay, meaning that opt-out. So you allow me, you giving me consent to do anything. Okay, if accept this, something like that. Okay, you get some right for them to do some coming experiment. Okay, but you need to actually, if you want to get this informed opt-out consent from the patient, you need to make sure they know. Okay, make sure they know about this, they sign, that they know that they are aware of this existence. Okay, we have sample with you, and I trust you, I give you the right, okay, to do, unless it inform certain case. Later we will see what are the exceptional. Okay, certain experiment we cannot apply this opt-out procedure. Okay, but some minor one we can apply for the approval. Okay, but we need to make sure the participants aware of this one, and you have provided sufficient information for them, okay, to understand. And patients will need to be told that they can withdraw their data and they have possibility. Okay, always they have the right to object the use of their data and their specimen. Okay, this one material is usually stored and used for the research unless the person you obtain from the donor shows their objection, okay, refuse. So you cannot use this. Usually some patients will say, oh, you cannot do anything on my sample. So if they already express objections, you cannot do any opt-out, informed consent, opt-out procedure. Meaning that they already have some very determined, okay? Implicit meaning that undoubt, they have a very clear mindset that they don't want you to use their sample. Okay, so you no longer need to try the informed opt-out concept. Okay, so informed opt-out procedure is not allowed. As I mentioned, there are several cases where you cannot use the opt-out procedure. So the first one, research involve more than minimal risk. So if you are subjected the participants with more than minimal risk, okay, or expose them to a higher risk compared to their routine work or routine examination, so you cannot exclude. Okay, you cannot do this opt-out procedure. And then when you want to use their cell or tissue to create a new cell line, this one you need to get their consent. Okay, anyway you need to get their consent, and you cannot say that you already signed the opt-out procedure. That's why I proceed. Okay, making the new cell line using your tissue. Or any study involves special gametes, okay, like fertilization, okay, cells or tissue, or involve any human embryo study. Okay, we cannot allow the opt-out procedure. You must get the clear consent from the participants. Yes.
Why is it not allowed in the human embryo study?
Because it involves some personal, like genetics information, right? Like the gametes or sperm or ovum. Not that you don't say, I agree, I assume you agree. So this one you have to make sure that you emphasize for them that I'm going to use, right, your egg, I'm going to use your some gametes, okay, for some embryo studies. This one you have to complete. This is one of the procedure to make sure, okay, they are aware. Okay, not saying that, because sometimes the opt-out is like they don't really aware, okay, on what you are going to do. So I trust you can do anything lah. So it's a bit dangerous if involve some gametes. And if you involve involve some vulnerability test or some sensitive issue, okay, like paternity test or some disease test, so you cannot simply use. Okay, who will tell you you can use or cannot use? Yes, the committee. When you do some application that you want to apply some opt-out procedure, so you are subjected for their approval, okay, whether you can perform this procedure. So next one, you can also have some authorization used for the archive material, where some of the informations or biological sample where you were obtained in the past, okay, you already keep for quite some time, long time ago, okay, so all the records are already keeping in a very quite a long periods ago, okay, so you may apply, okay, some authorizations to use the biological samples or related data if the informed consent was not able to obtain in the past, okay, so in the past already no consent, so it is impractical, right, to contact the donor or participants, right, so it is impractical or it is hard or not expensive to locate the person whose materials are recorded to be examined, and you need to have a social value, not do just based on your own interest, you need to make sure that you have a scientific, okay, scientific sounds methodology and sounds research study, and it should poses no risk, okay, to the participants. Then you can authorize the use of this biological material. So usually, for example, if you study only involves some review of medical records, okay, or performing some new tests of the blood collected stored in the past, okay, we want to take out all the blood and do some new tests, and usually in these situations we will not look for the consent, okay, we will not, because it's already many years ago and last time we do not have any consent and we don't know how to contact back, and it's unpractical to contact back the donor, okay, we will just use the sample. So last one, we will cover the reimbursement and the compensations for research and participants. So to initiate your any research study, you need a sponsor, okay, or a grant. So why do we need a sponsor or a grant? Because to back up us, okay, to back up us in case you want to do any reimbursement or any compensation to the participants if we have created any harm to them or any damage to them. So most of the study will involve no potential benefit, okay, it is okay because just based on their voluntarity, right, to involve in the research project, so it is okay. But sometimes you do request your participants to get additional blood drawing or request them to stay another night due to your research study, okay, extra hospitalization, or you need extra hospital visit, come back for a follow-up. So all these may increase their risk, okay, may increase their risk and lead to the needs of the compensation. Later we will see what types of compensation, and usually we will not provide the direct benefit to the participants, okay, and because we don't know the research is really will benefit or not. We are doing research, we are going to evaluate and integrate the results, right, so we are not sure whether it can bring, okay, usually we will emphasize in our consents that this research study will not provide any direct potential benefit to the participants. So the participant will, if they are still willing to join, meaning they are really based on their voluntary, okay. And then some research interventions or procedure. Your study is good, but it may involve some procedure, okay, which may cause harm as well. That's why we need the scheme of reimbursement. Although you already plan your study very well, but some harm cannot be avoidable. Okay, that's why we always need some grant or some sponsor to back up, to give some reimbursement or compensation in the case we have already created some problem. So next one we have the reimbursement. Actually, in Cure by Research, we always do some travel costs. Are you all not aware about the reimbursement and the compensation? So reimbursement is like transportation costs or the meal costs where you already pay and then you reimburse. Okay, you claim. Okay, you have performed something, you have do something, or you need me to visit many times to the hospital. So I want to claim back my transportation. Okay, this one is termed as reimbursement. And reimbursement always do allow. Okay, if you have additional request for ask them to reimbursement the overnight of hospital stay. Okay, if that one is based on your request, so you can reimburse. So compensations is incurred, but like compensate, we do some give you some compensation. I mean to adjust back your inconvenience, okay, or time spent, okay. Like we give you some voucher, okay. The compensations can be monetary or non-monetary. Okay, you can give them some special service of healthcare service, medical service, or counseling service, or monetary, not direct cash, okay. So you can give some voucher, okay, or token, appreciations of token to compensate their time spent or to compensate their inconvenience. So all reimbursement, please bear in mind that all reimbursement and compensations must also approve, okay, by the committee, not simply that you can actually under table, okay, can give all the reimbursement and the compensation illegally. So you must obtain the approval and justify why you need to provide all the compensation. And your compensations cannot be too attractive, okay, cannot be too large with a huge amount of voucher or gift, okay, which may influence the judgment of the decisions of the participants, okay. And please do not simply give compensation, okay, upon your preference, okay. So if the participants already signed the consent form on the certain risk, so if they really experience that specific risk, so you has the right not to give the compensation, because we already expect that risk may happen, okay. So if the participants already give consent, okay, even though they already aware that the risk might be happen, okay. So we only give compensations for those unexpected, okay, unpredictable risk or harm that has incurred to the participants. So last one, we have the compensation. So for the compensations for the person who are incapable of giving the consent form should give special attention, okay, because usually for this population, they are incapable of giving the consent form. Usually they are under control by their guardians, okay, so or their parents or their representative. So usually these people may take the advantage, okay, from this population, because they know that they are incapable of giving consent form, so they try to claim some reimbursement or compensation for themselves, okay, instead of the participants, okay. You need to make sure, and usually for those who are incapable of giving consent form, we will offer only reimbursement, okay. They will use the money first and then claim back their transportation fee, and usually we will provide non-monetary compensation, because this is the reason we do this is because we want to try to avoid any guardians or any representative make any advantage on this population, okay. They may take over the compensation, okay, instead. So please make sure that if you are providing some reimbursement to the for those who are incapable, or for those who are child, okay, so make sure you are targeting to them. And sometimes we do provide some financial incentive to attract the participants, okay, not saying that it's not allowed. Sometimes in some certain scenario, so you need to provide some financials and incentive, like to promote, okay, overcome their economic hinders, okay, obstacles, So try, for example, let them has easier support to access the healthcare, and then let them has easier support to continue their treatment. Okay, so usually we will give financial incentive if your study involve certain long-term study, where you can also increase their motivations to participate. Okay, so you need to make sure you can provide some support for them, incentive for them, to encourage them to come back for a follow-up if you need them for a long-term study. Okay. Last one, we have the treatments or compensations for research-related harm. So any research may causing physical, physiological or social harm, okay, are entitled to get some compensation. Okay, you may request the free treatment or equitable compensations from your research participants. Okay, they are harmed by your research. So doesn't matter what kind of harm, physical, physiological or social harm, you are entitled, okay, to request for the compensation, and your participants must not be required to show any neglect or lack of the skill, okay, on the researcher in order to claim the free treatments or compensation. So whenever you have created some harm to them, so they have the right, okay, to request any compensation. So you can provide, okay, some rehabilitative service to them to recover, or to provide them additional care, additional treatment for them from all the side effects or all the harms. And participants should not also being asked to waive. Okay, in your consent form, you cannot include any statement that to waive your responsibility if you have already created some harm to your participants. And do not ask the participants to let go their right to request their compensation. Okay, so you need to make sure that your participants has the right to request the compensation if your research has incurred some related harm. So this one have to clearly mention in the consent form. So next we will go into our use of animal in the research. So it will just a short topic involved. So before we go into this one, so any one of you has any idea on the disconnect again? Okay. Okay, so any one of you has any idea on what are the majorities of the animal, living animal used in the research? Anyone? The most majorly used animal. Yes, mouse. Okay, so we have some statistics showing that compared to the fish or rats, or some we will use rat. Okay, and in current research, it has a lot of study involve the use of the fish. Okay, especially the genetic study, research study involve the genetic and the use of the zebra fish. Okay, and then we have also involved some big animal. Okay, but it is not always allowed in the research study. Later we will know why. Okay, some dogs or some study likes to use cat, or some study likes to use a pig. Okay, in their research. So the mostly used according to the statistic is the mice. So what is the role of the animal in research? So we widely use animal in the research is because we want to do some drug testing, and then in another second reasons we want to include animal in our research because we want to do the research on the animal in itself. Okay, such as the research involves some veterinary medicine, we want to create some antibiotics for the animal, or we want to create some drugs for the animal. for the agriculture use or the aquaculture use. That's why we need them to involve. We need to use them in their research. So in terms of animal, we also have animal also has moral, and then they deserve respect, right? We need to respect them as well. And laboratory animal may subject to reduced animal welfare and greater risk than ordinary livestock. So compare to your pets, okay? Compare to the animal in your house, your pets. So all the laboratory animal actually has reduced welfare. Who is going to take care of all the laboratory animal welfare? Are they going to speak for themselves? No, right? So, and then they usually has a greater risk than the ordinary livestock, because usually we will sacrifice them. We will sacrifice their life in the research. So that's why we need the control. So who are the personnel going to do some control on this animal research? So for human research, we have the IRB, right? So Institutional Animal Care and Use Committee. In short form, we known as the ICOAC. Okay? ICOAC Committee, also known as the Animal Ethics Research Committee. Okay? Animal Ethics Committee, who is the responsible to take care, okay, to speak on behalf of the animal. So what they are going to do is usually they will review your proposal. Okay? They will approve your protocol for animal study, make sure all the protocol you're using is appropriate. Okay, all your protocol not cruelly or avoid sufferings of the animal and avoid pain or distress, and try to protect the quality of the life of the animal. And then they have to make sure the committee will monitor your study. Once you have created any death, even animal, once you created any harm or any death, so they will actually suspend, okay, your ethics approval. And then they also have some they also has a role in make sure that you're compliant. Okay, you do whatever according to the standards of veterinary care and transportation, and make sure you report all the adverse effects or unexpected outcome, okay, or unexpected pain or death induced to the animal. So this is their role, okay, to take care of the animal affair and speak, okay, protect the right of the animal. So of course we know that for animal we also need respect, okay, we need to respect. That's why we need a scientific, sensible topic, meaning similar to the human ethics. You need a sound scientific research, okay, with a right objective, and you need to address all the care to meet the animal needs, okay, in your animal ethics proposal. And we have three important principles to be covered in animal research, which we known as the 3 R's. Okay, so this is important. Whenever you talk about animal research, you have to know the 3 R principle. So the 3 R, the first one is the replacement, reduce, and refinement. Okay, you have to make sure you know the 3. So the 3 R, replacement. Try to seek alternatives to experiments on animal. Not always straight away start your work straight away to the animal, even though they are low-class animal like mouse or rats. They are live as well, right? Okay, you can do some preliminary tests using some in vitro or cell culture work instead of directly inject your drug to the mice. Okay, so and then try to optimize your method. Okay, try not straight away, try to find an alternative method, okay, to perform your experiment, and prefer lower level over the higher level animal. So meaning that usually we will prefer starting your research study in mice if it is unavoidable to use animal research compared to use a bigger higher end animal like dogs or pigs or cat, okay, or monkey. Okay, so next one we have the reducement. So reducement, try to reduce the number of your mice involved if you cannot avoid animal study. So try to do some literature search, reduce control, do some pilot study. Anything you can try to reduce the use of the mice. Okay, don't waste the mice before you do any literature study. So study first. do some statistical design. Do not simply repeat. Okay, I failed in this experiment. I want to repeat another step, which involves 30 mice. So continuously repeat will cause the wastage, okay, of the life, and then try to use new method in the testing. So sometimes if you apply some new method, you can reduce the number of use of the animal. Then the last one, refinement. We have some appropriate use, reduce some suffering. Okay, try to know some appropriate humanized endpoint. For example, you try to inject some tumor cell into the mice. So you let the tumor to grow, right? So to grow bigger during the study. So at the end, the tumor will have a very big size of the tumor burden. So is that an ethical activity, ethical approach? No, right? So you cannot let the tumor grow unlimitedly in the mice, although they are just animal. So you need to set a time point where the tumor already grow more than this size. You have to human sacrifice. Okay, you have to reduce the suffering, and you need to include all the proper training. Okay, make sure that you have proper skill. Don't simply do some surgery on the mice. So if you have not ready, you have not the skill. So this will create some risk, right, to the mice, or you can create some death. Okay, increase the mortality of the mice if you perform some surgery inappropriately. So proper use of anesthetic and analgesic. Okay, so anesthetic is the drug you put the mice into sleep, put the animal into sleep. Okay, and then analgesic is like painkiller. After you perform some surgery, the mice having some pain or suffering. So you need to try to reduce their suffer. Okay, reduce their suffer, and modifications of restraint. Avoid all those cruel technique, like just cut their vein to collect the blood. Okay, all the cruel experiment, and you need to know their behavior. Okay, to make sure their concern, their care is delivered. So next one, you need to balance the risk and benefit. Although they are animal, so you need to make sure your study incurs balancing between the risk and the benefit. So if your study involves very high risk or very toxic, where all the mice can just die, okay, in a sudden, so you need to pay, okay, you need to pay extra attention on your experiment design. Okay, risk of suffering, do not let them to suffer. So if you are performing your experiment in air conditioner room, so you need to provide them a heating, okay, a heating instrument. Make sure they have some warm. Make sure they have warm, okay, to instead of their continuously exposed to all the cold temperature during the surgery. So suffering only can be caused to animal if this counterbalanced by a substantial or profitable benefit for the animal or social value, unless you have a very strong justification or profitable benefit. Okay, so otherwise try not to create any suffer to the animal. Next one, we have maintaining the biological diversity. Make sure the use of lab animal do not affect, okay, all the ecosystem, and do not use any endangered species, okay, in your experiment, or some vulnerable species which may subject reduced to the absolute minimum number. For example, tiger. Okay, please do not use those animals in your research study. And interventions in a habitat. Reduce the disruption, okay, of natural habitats, and try to install a measuring device which should affect, okay, the living habitats of the animal. Please try to maintain the ecosystem and the animal habitats. For sharings of data and material, so avoid unnecessary repeats of experiment. As I mentioned, so any research study involve animal, usually we do not allow for repeats. Okay, so for the ethical approval from the ICO committee, usually they do not allow you to repeat. You can assign your group with 5 or 6 mice per group and obtain statistically value, but you cannot simply repeat, okay, the animal work and disclose negative result. Even you have failed in your experiment using the mice work, you need to disclose. Okay, negative result also results, right? So you need to disclose to disseminate the knowledge to the social to prevent the wastage of the animal use. Okay, people already know that this drug or these interventions are not going to work, so they will not do anymore, right? They will not repeat the same experiments in the mice work again. So in this one, indirectly, they will reduce the number. And expertise of animal, as I mentioned, please make sure that you have the knowledge to handle the animal. You have to attend the animal training, okay, to show that you are ready. Okay, you are ready to handle all the animal, especially if you want to perform some surgery on them. And then ability, you have the ability to take care of the animal properly. So all this you need to provide certificates of training to show that you are eligible. So we know that we need to respect animal. So do we need to obtain informed consents in animal? Yes or no? Voting time, responsive response, timing to respond after long periods of silence. Do we need to? They are living organisms as well, right? So do we need to obtain their consent? No, right? We don't need to, okay? Because they are incapable to respond and think. So that's why we need the committee, okay? We need the ICOOP committee to speak for them, okay? If you are keep injecting, okay, high dose of anesthetic drug for them, so ethics committee will come to you. Why? Why do you want to induce such high concentrations of drug to the mice? Why do you want to do that? Why do you want to cut their tail and get the blood? Why? Why you want to harm them? What do you want to? What are the degree of the pain or suffering they will experience? Okay, that's why we need the committee to protect their right. So usually this ICOOP committee will involve some veterinary officer. Okay, in additional to the institutional officer, we need some vet because they have the most proper understanding on the animal care. Okay, in addition to the scientists or all public or the non-scientific background, okay, committee or officer. Okay, next one. So we do usually monitor the health and suffering status daily in the human. So doing so, we will violate. We do not usually do. Okay, we do not usually monitor the health or suffering status of in human because sometimes we may violate the principles of privacy. Right? We do not actually monitor. Okay, their sufferings or pain. So, however, in animal, do we need to monitor? Yes, because they will not able to express their pain and suffering, right? So during your surgery, all your animal might die because of the cooling of the temperature. Decreasing temperature may cause death to the mice if you do not provide some heating lamp or some heating bed, okay, to the animal during the surgery. So always try to think for them, okay, and try to, usually we do put some Vaseline on the mouse eye to prevent the dryness of the mice if you keep expose them with a strong UV or strong light. So last time I will put a cover of Vaseline to close their eye, to cover their eye, okay, before I inject some UV light or infrared light to them. Okay, so should we terminate a study once if we encounter some sufferings happening in some animal? Okay, yes, we need to terminate. Okay, and ethics committee has the right to suspend, to stop your research study if they found a sudden death of your mice, okay, or any suffering. So the ethics animal house will have some officer or you have your own role as well to monitor, okay, what happened to the mice. So if you realize that your mice show some decrease of weight, for example, or lack of motion, or increase of morbidity, okay, or remove of a lot of fur, okay, all these signs and symptoms will give you hint that the conditions of the animal is unwell. Okay, you need to pay attention to all that. So once the committee has found out all this happening, so you need to, okay, sacrifice them. You need to sacrifice them and try not to let them continuously suffer from all these adverse effects, okay, or paralyzed. So if you found that your mice suddenly cannot walk or cannot move, so you need to sacrifice them because they are unable to, they are suffering because they are unable to get the food and the water. Okay, so last slide. That's all for today. My God, disconnect again. Okay, that's all for today. So I will see you all on coming Thursday tutorial where we will discuss the coming assignment. Okay, the case study assignment in the tutorial class. Okay, so please